morning. I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. I'm with Colleen today. My colleague, Colleen's a psychologist in Genea Hollywood. I got a list of questions. I've done my homework to ask Colleen today. First, you're going to do a little game. You may have known that I've looked around for healthy snacks and food in Perth. So went to this cafe called Nature's Harvest. I promised them I'm going to show their card. Here we go, and I bought some food. So firstly, they let me taste their drinks, a latte. So slightly different between me and Colin. Cheers. have a drink and let me know what's inside. It's not bad. I've tasted that earlier on, but
I think it tastes coconut, turmeric.
Turmeric, yeah. It's turmeric latte.
A bit peppery.
Shouldn't be in yours. They might have included a little bit. They do have black pepper. So what else do you think's inside?
Cinnamon.
Cinnamon, yes.
It mainly tastes peppery, coconut, and maybe some coconut milk.
They have vanilla, nutmeg, not
Okay.
quite coconut.
Yeah.
But the one yours is called Shroom Magic Turmeric Latte.
Okay.
So loads of different mushrooms. They
Yeah.
have cordyceps, lion's mane,
Okay.
reishi, chaga, turkey tail, and they have nutmeg, cinnamon, cloves, ginger.
It's good.
vanilla.
It's quite
It's a bit
savoury.
like soup. Yeah, it's quite a bit savoury. You know,
Yeah.
when I tasted it, it tastes a bit like soup, but it's quite nice. Here you go. I put it in. I take a photo and put it later on. And mine is turmeric latte with ginger, vanilla. I think it's the one without mushroom, perhaps.
Yeah.
So and also got snacks, healthy snacks. Have to go.
Thank you.
Let me know what's inside
Okay.
once again. I took a photo of the ingredients, so it's from the same shop.
Obviously coconut.
Coconut, yeah, I can see it.
Maybe cacao or something like that.
No cacao inside. Come on in.
Sorry, Jude.
Right, sorry for the interruptions. Where were we? Yep, we were tasting that. You say there were coconuts.
Dates.
Dates. Let me see. Where's my phone? Oh, hang on. It's over there. I took a picture of the ingredient from the shop. They don't have dates in this. They usually do for the sweetness, but not for this one. I think, you know, dates usually make it a bit more stickier and sweeter, but this one, not in this one. Can you guess anything else?
Gosh, they've got something, maybe raisins, some sort of dried fruit.
It's blueberries.
Blueberries, okay.
The one you have, just like what you have on your desk.
Yeah.
So it's called blueberry bombs.
Okay.
So the blueberries, the nuts, they have cashews, coconut as we can see, maple syrup, fresh lemon essential oil, and Himalayan salt.
Okay.
So those are the
A
ingredients.
little bit different, yeah.
It's not bad. It's not bad. Right. It's pretty tasty. I tasted early on. Right. Let's go on to once again. You know, the food, I bought it from Nature's Harvest. Now go on to the main topic of what we're going to discuss with Colin. So Colin went through IVF myself. I find it, you know, the process, it is stressful. You go through a process with injections, scans. You have a schedule to meet, and then you wait for results. And many times it may not be successful. So probably, I think, you know, as you're the expert today, I'm going to ask you a few questions and see from your point of view, what should we learn and what should we expect for patients going through fertility treatment and also IVF. The questions I have, number one, is from your experience. What are the possible feelings when starting and going through fertility treatment?
I think initially couples can be quite excited to be starting, feeling that we've been on average, people have been trying for about 2.5 years before they seek assistance.
Okay.
So it's really dominated their life for a long time. So by the time
Yes.
that they see a specialist and get some intervention, get some advice, do some testing, maybe get more of an idea of what may be a barrier that has been hindering their chances to date, that people are usually quite excited to say we're trying something new.
Sure.
Now,
This hope, I think, to say that we're doing something.
And expectations can be pretty high.
Okay.
And if it doesn't happen with the first cycle, couples are invariably disappointed. So I think really talking to your specialist about what are the success rates likely for us, for our individual situation, because the more realistic your expectations are, I think you can prepare yourself emotionally for the journey.
Absolutely. I think when patients see me the first time, I always let them know, look, you know, you may need more than one cycle, or what's the success rate, etc. I think that's very important. Good. Number 2, second question. Do many women know that they are eligible for counselling when going through fertility treatment?
I think through our clinic, most patients are, because but patients get so much information. They're always informed by the nurses when they start that they are entitled to counselling. Genea Hollywood's quite unique in that we offer 2 sessions per cycle, and we also have a patient support group once a month. But patients sometimes say they forget because they get so much information at the get-go.
Too many things to do.
They're thinking, I'll hold on to my counselling until I really need it. And we encourage patients, no, you don't need to do that because we're here for you. Use it per cycle. So we're here to support you.
And I believe there's no extra charge. It comes with a cycle fee.
Yeah, exactly.
Many people actually don't know that. It's a shame, I think.
It's included in their treatment.
But hopefully not from Genea Hollywood. As far as I know, all my patients
and we can do phone, Skype, in person, whatever works for them.
And do you have any ways to, probably we talked about it earlier on, any ways we can encourage women to attend?
Yes, I think, but just one of the ways we do that is by making it flexible as to how we see people. Because patients may say, I came in for a blood test in the morning, being able to get away again for another appointment for counselling is demanding, which is why we'll say we can do it by Skype, do it by phone, whatever works for the couple.
Make it easier for them. Beautiful. Apart from, many of our patients are male, female, and trying to get pregnant. Do you see any other group of patients?
Yes, of course, we see same-sex couples. Under West Australian law, we can't yet see men. But we see a lot of same-sex female couples with their donor. And we frequently would see donor scenarios and support patients through that journey. Because obviously there's a 6-month wait in WA to use donor sperm, so we tend to get to know the patients fairly well. But that may change because I know that the Act is being reviewed.
Well done. Yeah, things change every so often. So.
Or we might see single women who are using donor sperm.
Beautiful. Right. Do you have any advice regarding coping strategies if people find it stressful during the treatment process?
Yes. I do encourage couples to come and have a chat with us. I encourage couples to look at it is a couple problem, it's not an individual problem. Sometimes people will apportion blame or feel like they're responsible for the treatment, but there is no test, as you're fully aware, on the planet to tell us definitively whether it's a male or female issue. Encourage couples to look at it as 50-50 and to support each other. Men often say they feel like they're witnesses to it because it's all happening to their partner's body. So I encourage couples to talk about what can you do or do you already do that we can encourage you to keep doing to support one another through this. So couples might say we go for a walk every evening, which we weren't doing before. We're doing something that we're staying connected through the journey. Talking to couples about what impact has the fertility journey had on their sexual intimacy and is that something that they can reconnect for fun. Because it's become quite focused on purely on the performance of trying to conceive, and that takes its toll as well. So we look at holistically what can we do to support the couple in terms of their connection for one another.
Yeah, I find it in terms of working, some patients will feel more relaxed stopping work. They think their work too stressful, but for some patients they say actually when I work I take my mind away. It's a better way of coping.
I think there's not a one-size-fits-all. Everyone's different. Some, I'd say many women report if they take the whole time off of the whole cycle, then they try and project manage the treatment and it becomes overly demanding. That it's getting the balance right.
Sure.
You know, with your exercise, with your self-care, with your socialising, looking at what is safe for me to do, but keeping the balance right. Otherwise, this totally dominates. Which if it's one cycle, that's okay, but if it's repeated cycles, that can take its toll.
Very tiring, yeah. How about talking to friends and relatives? What's your advice on that?
I think, again, everyone's situation is unique. If you have supportive family and friends, people are often surprised when they tell people that they're going through fertility treatment, that others in their circle, their boss or a friend may say, we went through fertility treatment, but they just haven't discussed it before. So the most common response I see is people get more support than they had anticipated from the people around them.
Oh, that's fantastic.
Yeah, that's what most people find.
That's fantastic.
Sometimes people say it's hard to be around other pregnant women. I'd say just be gentle with yourself. One of the articles that we give out to people commonly is coping with other people's pregnancies because it can be demanding.
Okay.
And people, unless they've been through the journey, it's difficult for others really to fully understand what you're going through.
Sure, can imagine. Now, I mean, fertility treatment, you know, roughly speaking, can divide into different phases. You have the active treatment side, you have the egg collection, and then you have embryo transfer, and then you wait, roughly speaking. For me personally, I find the waiting part is more stressful. You know, it's like waiting for results, and you do nothing after embryos goes back. Well, my wife took support and such, but there's no active schedule and such. But I'm sure for different people, it could be different. In your experience, at what stage do most people find it the most stressful time period?
I'd agree with you, the waiting.
Yeah.
So after, if it's a IVF cycle, after egg collection, waiting to hear how have the embryos, how are they developing? Did we get fertilisation?
Nerve-wracking.
Have we got embryo development up to day 5? And then I think the most significant wait for patients is often the 2-week wait, waiting to know are we pregnant?
Absolutely.
And it's going to feel like 2 months. Whatever you do, it feels a lot longer. So encourage patients to look after themselves through that phase. Try not to do home pregnancy tests. If you really want to do one after you get the confirmation from the nurses to make sure it actually works. But otherwise, I think try and avoid doing them because they do increase anxiety and they might be inaccurate.
Absolutely. Yeah, it's too early sometimes. Good. The final question I have is any hindrance for patients attend? We talked about early on. You know, is any hindrance for them coming for counselling? Talk about time-wise and how to fit in, etc. Do you think there's anything else stopping them from coming for counselling?
I think sometimes people are, it's an extra appointment and they might not be appreciating the potential benefit at this point. Sometimes people associate counselling with mental health struggles, so saying, oh, I'm really not struggling, so I don't really need it, without appreciating that the role that we offer is more holistic than that. We might look at lifestyle factors with a patient, so someone who's trying to stop smoking and provide them with a quick kit or something like that. So it can be, it's really a space, the safe space for the couple to explore any extra pressures or demands on them that we may be able to help them alleviate, just to make the journey that little bit smoother.
Yeah, I think I do agree. I think it's part of the treatment process, not just the drugs, you know. It's the whole holistic experience. And if you look at research, they do say if you manage your stress level well, you do have high success rate. So actually it does affect biology as well.
Yes.
Thank you. Is there anything else you think you should add on for our patients today?
I'd wish all of our patients the best of luck. And say, if you were thinking about seeing a fertility specialist, I'd do it sooner rather than later. Because often, on average, people do wait 2.5 years and you can lose precious time. Can
be too long sometimes. I think that's it.
Okay.
Thank you very much. It's beautiful. I'm going to turn it off.